All right. So everything fine? Am I audible?
Yes.
Okay. Once again, thank you very much, Oniban and others, for this opportunity. I feel a strange sort of duality. You know, our existence these days is in many ways so local, but in some ways so global. I mean, look at the webinars and the interactions we are having across the globe. So it's wonderful that way. As I said, I'm primarily a theorist. So in this talk, what I'll try to do is highlight certain conceptual points rather than, you know, I won't be offering you a lot of data and empirical meat. My points, if you're interested, it's coming mostly from two op-ed style articles which I wrote. One came out in Ideas for India and the other in medium.com. On my slides, I have hyperlinks. So in case somebody wants to read them, you can just click on the slides. So let me start, you know, one metaphor which many people have used, and I discovered that me and my advisor, Devraj, and only once, we have a common advisor, Devraj Ray, we sort of independently use the metaphor of Scylla and Charybdis, which is from Greek mythology. Basically, you know, if we go too hard in trying to avoid the pandemic, then we have the danger of, you know, creating economic catastrophe. And if we try to avoid that economic, you know, implosion, then the disease might overwhelm us. So we are charting a very narrow course. Since India's lockdown is kind of winding up, let me start by talking a little bit about what I think should, you know, be the outline of a long-term strategy. Now, on the epidemiological aspect, you know, many people have said, I mean, I won't say it's a consensus, but some sort of consensus that things like lockdowns, they are hammers, they are very blunt instruments, so they create a lot of collateral damage. So thinking for the next several months going ahead, we need to develop strategies which are much more surgical. Surgical strikes is a term which many of you will be aware has been popularized quite a bit in India. So for fighting the disease, that is something which should be perhaps used. You know, it's summarized in this aphorism, test, test, test. So test, isolate, find hotspots, identify the individuals who are carrying the infection, try to quarantine them, and so on and so forth. So that strategy needs to be developed. Now, in terms of the economics, you know, so handling Scylla and Charybdis at the same time. So how do we handle Charybdis, let's say? Well, here's my 4 bullet points, and they are in a particular order. I would argue that, you know, this should be the order of priorities, with the first bullet point being, in my opinion, the most important, at least in the immediate future. So economic policy needs to protect the economically vulnerable, and that's a lot of households and a substantial section of the people who are facing catastrophic outcomes under the kind of suppression measures that are going on. Secondly, policymakers need to stave off permanent damage. Right, permanent damage is where, because of lockdowns and etc., you know, firms go into bankruptcy, into insolvency, they shut down, and especially the MSME, the micro, small, and medium enterprises sector of India, which accounts for a very large share of both employment and production. It's 110 million workers, and GDP-wise, it's something around a third of GDP, if I recall. The third economic challenge will be sort of managing the transition. Right now, things like, you know, liquidity infusion, stimulus, these are of no use because physically we are restricting people to go out and produce. But as we transition to a more normal economy, one of the dangers is that we could get into a Keynesian recession, for example, that, you know, for due to sort of months of everything being put into a coma, economic activity, it may not be so easy to sort of snap back into, you know, full-fledged production mode because there's a downward spiral of demand and so on and so forth. And the fourth point, which I think hasn't received a lot of attention, and I really, really hope, this is in my last slide, but if I'm really hoping to get to that, which is that if we are talking of a more surgical strike kind of approach towards the disease, that eventually we'll have to move away from these hammers of lockdowns, then economic incentives will become very, very critical. In particular, I'm going to argue, since I may not get to that point, I'm going to argue that it is very critical in all the economic package to include things like quarantine allowance, okay? So people who will test positive and who by policy, by law, will be forced to sort of get into either home quarantine or in an isolation facility, their livelihood losses for 3 weeks, 4 weeks, whatever the period, that has to be paid by the government. This is what will incentivize people to be willing to come forward and get tested, and if they test positive, to comply with the social distancing, etc., etc. There are some examples of this, but very few. Singapore in particular, they're paying 100 Singaporean dollars to every Singaporean citizen who's testing positive and who's taken out of circulation from the economy in the process. 100 Singaporean dollars is a little more than 5,000 Indian rupees. That's per day. So that's a pretty healthy allowance. And I would argue that India needs to seriously think about it if we want to go into this sort of surgical strike approach. Now, let me come back to the what exactly, at least in the sort of short to medium term, what exactly is the economic threat that we face? And a lot of stuff has been said about GDP projections, and it's very difficult. Confidence intervals are bound to be sort of massive if we estimate these things at this point. But IMF and Goldman Sachs, they come up with like a new estimate almost every day, each getting more stark than the other. Let me sort of jump to this slide. It is useful, I think, to distinguish between two economic threats. One is the shrinking pie, that things are not being produced, so the pie is shrinking. The other is how the pie is going to be divided in this COVID economy, if you will, right? And on both fronts, there are major shocks that we have received, but the shocks are different. And in my opinion, it's the second shock, the income distribution shock, not the aggregate supply shock or production shock, which for the next, let's say 2 months, 3 months, this is what we should really, really worry about. This is a much more important. Of course, if things drag on very long, if you're talking of people sitting at home for 6 months, 1 year, then of course the other shock, the shrinking pie effect, is of course going to be very, very critical. One reason I think we are being a little alarmist maybe at this moment about falling GDP and so on, is that there's a lot of intertemporal substitution possibilities, right? That, for example, weekends might shrink later. If you could manage to come out in some shape in 2 or 3 months, then there's a lot of intertemporal substitution of production that we can take care of. To start production with a skeletal workforce is difficult because there's a lot of production is team production and so on and so forth. So, and here's a sort of historic reference which may be instructive. I mean, everything is different, but if you look at Barrow and others' work, they estimated using sort of variations across countries and regions in the incidence of war deaths as well as flu deaths. So using that sort of variation, they estimated the average global effect of the 1918 flu pandemic and the First World War, which happened around the same time. And they found sort of the immediate impact to be roughly comparable in size of both the war and the flu on production as well as consumption. But the bouncing back from the 1918 pandemic was much quicker than the war. And intuitively that makes sense because the war destroys productive capacity, right? Factories are destroyed, people are killed. And the flu effects are more temporary. Anyway, let me move ahead and let me sort of try to convince you of the point that there's going to be radical and absolutely sweeping changes in the income distribution. Whatever the pie shrinks to, it's going to be divided in a way which is radically different from before the virus struck. And one, again, I mean, this is not to say that, so my example is the 1943 Bengal famine from the work of Amartya Sen, where he documents that the pain of that famine was heavily concentrated in certain groups. It was not equally spread out. And that is why certain groups suffered huge losses and died in huge numbers. So here's from one of the tables that landless laborers, for example, right? So look at this number, 34. So from before the famine, if you go to the peak of the famine, the landless laborers were basically their real income was cut to a third of what it used to be, right? That's a dramatic downfall. And here in the second table, I'm not sure if you can read everything. These are sort of price indices in terms of the price of rice for various commodities like milk, fish, haircuts, and so on, right? So if you look at haircuts, the price of haircut at the peak of the famine was 20% of what it used to be in the pre-famine times, right? And this is the price of haircut. This is not even taking into account volume. I mean, lots of people stopped having haircuts. So imagine what happened to the incomes of barbers. So I would say that is a sort of a rough parallel to what we might expect in the COVID situation. And so the pain is going to be very, very unevenly divided. And that is something that policymakers need to take care of. This is also true, I think, at the business or corporate level. So here's a little table. Okay, thanks. Here's a little table which I constructed, and I should have done the same. I was looking at the figures for Indian companies. Anyway, this is changes in share prices for certain international companies over the last 3 months, since the outbreak of the pandemic. So you can see that it's extremely variable. And I didn't cherry pick to create this variation, right? On a priori grounds, I selected some companies. So you can see the online retail companies like Amazon, for example, they actually have come out way ahead. In the last 3 months, their share prices have jumped 22%, right? Getting close to a quarter. Whereas if you look at the usual suspects that you would imagine, like hospitality companies, travel-related airline companies, and so on, their share prices have dropped 50, 60%. I mean, we don't have quarterly reports. That's why I had to go to share prices, but these are indicative that the market thinks that the fortunes of even major corporations are going to show huge variations depending on what sector they're in. So this calls for a special effort at redistribution. Now, let me jump to India's economic package, which India has announced. Again, I won't go through the details. The highlight really is in-kind transfers have been, there's been a substantial push there. So India's public distribution system normally gives 5 kgs per head in a month. That has been doubled to 10 kgs. 10 kgs happens to be the average consumption level of Indian households, right? So if this is implemented properly, that grain requirements is taken care of, right? So that's a big plus. Other than this, what the stimulus package does is that it gives little dollops of cash transfers through this program and that program in a very sort of, ad hoc kind of way. But the way I see it, this doubling of the grains ration is a very useful thing which the government has done, but it's the cash transfer which needs to be scaled up many, many times. And that is what has not happened. If you look at India's, the quantum of, as a percentage of GDP, if you take out sort of budgeted expenditures which have been brought forward, if you net that out, India's aid package, the economic assistance package, is about 0.5% of GDP. And if you compare it with what many developing countries have done, they have gone to 10, 20% of GDP. So we are way, way behind. And that, I think, has to be ramped up a lot. The main challenge of cash transfers, giving cash assistance to households, is there's no easy way to do it. So the tax network, if you have to do it in America, you have the ready tax network. Most people are in that network, so you can you have the bank accounts and you can send it. In India, about 7.5% of adults file for income tax. The rest are completely out of the network. So we have to go through our various welfare schemes, right? And if you look at the major welfare schemes, you get a sort of complex Venn diagram. Each has some coverage, and there's some common coverage, but there's some amounts which are disjoint, and so on and so forth. So by the upshot of what I'm going to say, since I have limited time, is that in my view, as far as I can tell, the public distribution system is the one which I think is most suited for improvising a cash transfer program. First of all, it has the widest coverage compared to, say, the employment guarantee program, compared to the sort of bank accounts and so on. It has the widest coverage. It covers roughly 2/3 of the population. So that's a good thing. It may not be enough. The other thing is that, you know, many of these other programs have a lot of duplication problems. So for example, the bank accounts for the poor, which the government has been using to transfer very small 500 rupees. Some households may have 2, 3, 4 such bank accounts. Some households may not have any, right? So we have there's no one-to-one correspondence between the bank accounts and households. So PDS has a lot of advantage in that respect. In one of the articles, I made some calculation that, you know, if the government has transfers enough money to guarantee the poverty line for all the PDS beneficiaries, which is 2/3 of the population, and wants to do it for 6 months, you know, you can do the back of the envelope calculation, it comes to about 3% of GDP. That I don't think is a great deal. Now, there's a lot of talk which is going on right now in India about fiscal space. Where will the money come from? I would say there's enormous scope for borrowing from the public, and this is not being talked about a lot. There's likely to be an enormous, at a macroeconomic level, a savings glut, right? Because in any recession, investment demand is the most volatile, as we know. And in an uncertain situation like this, investment demand is likely to collapse, right? And if anything, people will probably increase their savings rate. You already see indications of this. This is a report from a couple of days back that banks are accumulating huge amounts of cash. These 8.4 lakh crores, which the commercial banks have deposited with the central bank, RBI, that's close to 5% of GDP. So what the government is doing, the government is taking all this money from commercial banks, you know, it's been put in RBI. RBI is paying interest at reverse repo rate, and the government is not utilizing this money. So if you're serious about, you know, large scale cash transfers and much greater economic assistance, then public debt is going to be the first thing to dip into. And then there's possibility of taxation, which for lack of time, I won't talk about. You know, some IRS officers in India recently got into, you know, they were punished because they started talking about wealth taxes and so on. And it was almost like they had committed blasphemy. So I don't see in a special year why one-off taxes, we're not talking of permanent increases in corporate tax rates, you know, why one-off taxes should be off the table. And people are talking about bizarre maneuvers like monetizing the debt, drawing down dollar reserves and so on. I don't think we need to go that far. I mean, there's a lot of resources which, if there's the political will, through public debt as well as through taxation, a lot of resources can be raised. And I think from less than 1% of GDP, we need to go to 3, 4, 5% of GDP to do economic justice. Thank you.
Thank you. So you have a bunch of questions. I will, so Tarun, you want to start off?
Yeah, so very nice presentation, I think very comprehensive. So my question over here is that, look, a lot of the pointers are to massive underinvestment in healthcare over the years, and that's in some ways why we're in this situation. Now, this health is a state subject, and the state coffers are empty. So it's not a central subject, it's a state subject. States don't have money, they have no tax revenue, liquor shops are shut down, there's no demand for petrol. Where do states get money to spend on healthcare or anything else? Where does the money come from?
Well, right now the joke is that all the drunkards are going to fund them because, alcohol sales have become announced, and that's a good sort of big source of revenue for the state. I'm not just joking, of course. Of course, you know, it's a peculiar disjunction that in this crisis, healthcare is a state subject, but states have very little freedom in terms of raising funds, and the FRBM Act really puts them on a tight leash, and only the central government can kind of release that leash, right? Raise their borrowing limits and so on. So there's a massive lack of coordination which we are seeing, right? That's certainly true, and you know, that has to be sorted out through meetings between the state governments and the central governments. From a longer term perspective, of course, even for, I think even for the most well-developed healthcare systems in the world, like, South Korea or Germany, it has shown up that when something like this hits, the healthcare system is overwhelmed by several factors. So one has to sort of, even for the richest countries out there, I think after this is over, some serious thought has to be given about healthcare inventories, whether there should be, and some people have made a point like that. For example, Paul Romer in his New York Times article says that we have to seriously think about, it's probably not going to happen through market incentives, creating an inventory of ventilators, beds, et cetera, et cetera. So the economics of creating backups and inventories has to be thought through. But beyond that, in India, we know that we have been criminally negligent on healthcare, right? As a percentage of GDP, it's barely above 1%, right? The public sector spending. So this has to be a moment of reckoning, that what are we doing about healthcare? So I don't know whether that will come, but it's way overdue.
So Parikshit, you have actually touched upon some of the other questions. So they're in the chat. In the interest of time, we'll move on to the next speaker, but at the end of it, it would be great if some of you could take on these extra questions.
Okay.
So we move on to the last presentation for today. So Adnan, are you ready?
Yes, thank you so much. Let me put on